Hello friends, here's a simple rule that will help you to create the clear corneal incision quite easily, and this is called the rule of 30. In order to compensate for the dome of the cornea, the keratome should be angled upwards to about 30 degrees. If the keratome is actually pushed horizontally with zero angulation, this will lead to a very short tunnel, which is what many of us suffer from. Also, if you angulate it too much at a greater angle than 30 degrees, then it will lead to a thin outer flap and a long tunnel, which can cause problems like overlocking. Now let's take this example. The eyeball is held coaxially or straight, and the keratome is pushed up at an angulation of 30 degrees and then dimpled and then pushed into the eye. While angulating the keratome upwards to 30 degrees, the posterior wall of the keratome should be almost in contact with the sclera. And once you've advanced it to about 1.5 millimeters, you gently dip the keratome in order to create the penetration into the cornea. This is the way in which it is normally created, and this is applicable as long as the eyeball is held in a coaxial position or straightforward position, or what we call the zero angulation position. However, in some cases, if the eye is deep set or if the superior limbal area is hidden under the upper lid for a superior clear corneal incision, the rule of 30 can be utilized slightly differently. In these cases, tilting the eyeball down by 30 degrees, we can not only achieve a better visualization of the superior limbus, we can also make a straight line incision which will create the same effect or same type of clear corneal incision as if the eye is held coaxially and you angulate the keratome upwards. Now let's take a look at this 30-degree tilt. You see in this particular patient, the superior limbus is not clearly visible because the patient's brow is very prominent, and also because this is a slightly deep set eye. In this case, creating a 30-degree angulation is going to be quite difficult. So you can use a different approach of the rule of 30 in this particular case. So what I do in this patient is I tilt the eyeball downwards, that is away from the site of incision, by 30 degrees. So the eye is tilted downwards by about 30 degrees, and in so doing you can now push the keratome not upwards but in a horizontal or straight position. The keratome moves in the straight position and then creates the clear corneal incision. Now this will have the same effect as if the eyeball was straight and you angled it upwards by 30 degrees. Let's take another look at how you can create a slight tilt and a clear corneal incision. 30-degree tilt away from the site of incision, keratome passes by almost straight direction and then makes the clear corneal incision. Certain corollaries to the 30 rule is that if you tilt the eye for 20 degrees, then the angle of the keratome needs to be only 10 degrees and so on, so that the sum of the eyeball tilt and the angulation of keratome will be equal to 30 degrees. You don't have to always move the eyeball out by 30 degrees. This is a better way by which beginning surgeons can master the clear corneal incision by slightly tilting the eye away. The chance of premature entry is much more common if the incision is attempted with the eyeball held in a zero tilt or coaxial position for beginning surgeons, and also under certain conditions like a deep set eye or if the patient has a Bell's phenomenon. So the recommended way of creating the clear corneal incision is to slightly tilt the eyeball away, if not 30 degrees, say about 10 to 20 degrees, and then enter with the keratome that is angled slightly upwards. Let's see this in the following video. So the patient is having a slight Bell's phenomenon that's causing the superior limbus not to be visible. With the help of any instrument, you take control of the eyeball, move it slightly downwards. In this case, I'm tilting the eyeball to about 10 degrees downwards, so I have to just angle the keratome to about 20 degrees. You straighten the eye. This has the same effect of dimpling the cornea and then enter into the cornea to create the clear corneal incision. This is the easy way and maybe the solution out for people who are having difficulties making clear corneal incisions with patients who have deep set eyes. Pass the keratome, then straighten the eye, which will have a dimpling effect on the cornea, and then make the clear corneal incision. I hope this video has been helpful. Thank you for your attention.